So I'm Dr. Sandy Rock. I'll let you know who I am and what my creds are, I guess we'll call it. I practiced medicine for about 25 years after graduating from the University of Virginia School of Medicine way back in the past century. And I switched from clinical medicine after doing emergency room and family practice for those years. I switched into sort of environmental medicine and risk communication. So I've been doing that for the last 25 years, including 15 years at the Hanford nuclear site, where I was the physician risk communicator out there, working with the workers who were concerned about exposures and such. So we're here today to talk about a very popular subject that's just everywhere, and there's lots of good information on the internet. There's lots of bad information too, but I've been surprised and pleased actually with the amount of good information out there, including from the CDC, the Centers for Disease Control. And you can go to cdc.gov and just look for coronavirus or whatever word you put in there. It's going to take you to their very informative site. And you can also just Google it or whatever search engine you want to use, and you'll find lots of information. If you have any questions about whether it's good or not, if it's valid information, you can do a number of things. You can get in touch with some of the authorities that are on the internet. You can find them through cdc.gov, or you can.
I thought, oh, you.
Cut. Or you can actually get in touch with me through Facebook or through Issaquah Highlands Community Association, I suppose. But I can certainly direct you to things. First thing I wanted to do is tell you that the name of the illness is COVID-19, 19 meaning 2019, which is when we first saw this thing pop up in Wuhan, China. That's the illness, and they've named the virus SARS-CoV-2. So it is very similar to the SARS virus. That's the severe acute respiratory syndrome that occurred, along with the MERS virus, which was a few years after SARS occurred. But this is how they designate it. So I'll probably be saying COVID-19 for most of it, or coronavirus. It's all kind of synonymous. And I will step out there and say that we are in the midst of a pandemic. And the reason they don't like to use the word pandemic is because it's a trigger word. It scares people. But pan simply means all. I don't know if I'm a grammar or not. So all, and demic, which comes from the Greek word demos, democracy, demography, it just means people. So when we have a virus going around the world, and once it's hit all the continents, by definition it's a pandemic. But there's two other parts of that are important to understand too, and that is, besides it going to all the different continents, it also has to be a rapidly transmitted virus, easily transmitted from person to person to person. And it has to have some severity to it. That's when we call it a pandemic. And there have been a lot of pandemics over the centuries, including cholera. We had a big one here in this country that you might not even think of as a pandemic, and it was global, and it killed millions of people back in the late mid part of the last century, called HIV/AIDS. That was a pandemic. We've had several influenza pandemics over the years, H1N1, and if you've heard of H1N1 or H3N2 or whatever, those letters have to do with the substances that are on the surface of the virus. The H, which is hyaluronidase, you don't really need to know that, but the H allows the virus to get into cells, into human cells. The N, the neuraminidase, allows the virus to get out of the cells. Which brings up a point. How do viruses work? They're not really considered living organisms. They're really just little packets of nucleic acid, DNA, RNA. This one's an RNA. And they get into the cell in all parts of your body, and some tend to prefer the lungs over other parts of the body, particularly the influenza viruses and these coronaviruses. They get into the cell and they take over the cell's metabolism. They take over its nucleic acid, its genetic material, and make that cell make more of itself, of the virus, and then it kills the cell. So once that gets into thousands and millions of cells in your body, especially in your lungs, and kills those cells and sets up an inflammatory response, that's why people die of or get sick, very bad sick, from infection in the lung, which we call pneumonia. So the good news about this, there's several good newses about this virus. And one is that it doesn't seem to be as lethal for most people as influenza viruses can be. And I see pointed out quite frequently in the news and in comments, Facebook, Twitter, wherever, that, geez, we have 16,000 to 80,000 people a year dying from influenza, which is true, depending on how severe the year is and whether people have gotten immunized and so forth. So this, as I say, we are in the middle of a pandemic. The government will very shortly call it that. But again, they don't like to call it a pandemic because it's scary. Well, we have lots of different opinions, and I like to follow opinions that are driven by science. If you're not familiar with the bell-shaped curve, I drew this on here just to, if you hate graphs, I'm sorry. But this is a graph of number of people on this axis and whatever value we're measuring here on this axis. And this means, let's say we're measuring heights of people, men. Let's start with men. So we know that there's some people that are really short, and they're going to be down here, and this is the number of people who are that short. And we have some 7'2" people who are going to be way over here, so very few of them. But most of us fall in here somewhere. But this can also be a measure of opinions and attitudes and fear and risk-taking and so forth. So some people don't take any risks with anything, and there are people that take all kinds of risks out there. And there are attitudes also and opinions about, for instance, this coronavirus. And there are some people that say, what's the big deal? There's nothing to worry about at all. And then at this end of the curve, we have people who are worried about every little thing that happens to them, and they attribute it to the coronavirus, and they think we're all going to die. Most of us are somewhere in here. And the more information you get, the more you move around in that curve. You know, if you think there's more risk to getting infected and getting sick and die from it, you're probably going to be up here somewhere. If you get more comfortable with it and you recognize that it's not really going to be that severe, then you're going to be down here in the curve somewhere. So we're hearing a little bit from everybody, aren't we? We're hearing lots of concerns about it. We're hearing other people just kind of poo-pooing the whole thing. And the reality is we're probably, the people that are right here in the middle are probably right. In other words, somewhere in between absolute fear and not caring at all is where we should be. So, more good news, or maybe it's good bad news, and that is that we're recognizing that probably a number of people, in fact maybe most people, get this virus and have no symptoms at all. We don't know what the percentage is, but it's a number of the total people that get exposed to the virus will develop no symptoms, and yet they'll have the virus, they'll get rid of it, their bodies will get rid of it by producing antibodies. And if we ever have a vaccine against it, that's what vaccines do. They stimulate your body to produce antibodies to that virus. And then they go on about their way. But unfortunately, the bad news part of this is that if they have the virus, depending on how long they carry it and around how many people they've been, they could pass that virus on to other people. So it's kind of good news, bad news. Most people don't get bad sick from it, don't get sick at all, but they can pass it to somebody else. So that brings up another question, and that is, who is most likely to have a bad result from getting infected with this virus? And the answer is really simple in the case of coronavirus or COVID-19, and that is mostly elderly people. So elderly means anybody older than I am. Elderly, it's a true story. Actually, I'm in that range now. But elderly means people who are 65 to 102, something like that. So, and people with underlying illnesses, especially lung disease, people with chronic obstructive pulmonary disease, COPD, that you see advertised on TV, people with diabetes, people who are overweight, massively overweight or obese, people who smoke heavily, actually, because they have reduced lung function, reduced ability of the lung to get rid of things that get down in there, like viruses. People with kidney disease, chronic kidney disease. Yeah, question from the audience.
If you're older, if you're elderly, as you said, but you're in good health, I mean, are you still at risk just because you're older?
Good question. The question is, if you're elderly, if you're in good health, are you still at risk? If you get your flu vaccine every year, you know that they've offered you a high-dose flu vaccine. Now, why is that? They do that because our immune systems elderly people over 65, let's just say, their immune systems are not as active and ready to respond to a viral attack as younger people. So we give you a bigger boost. So the underlying reason for that is that our immune systems wane as we get older. Another bit of bad news about getting older, but that's just the way it is. So yes, that's even if you're in excellent health and you work out every day and you're trim, you eat well, you eat right, you don't smoke, you don't drink alcohol to excess, maybe a drink every couple days or something like that, you should be all right, but your immune system, and I know what the next question would be, what can you do to boost your immune system? There are lots of things out on the market that claim to do that, but honestly, it's just good dietary, exercise, sleep, all those things that you hear about all the time, and don't take things that suppress your immune system, such as drugs, alcohol, and tobacco. Don't use those. So. But good question. Any other questions while we're...
I have a question. Did you hear if anyone who has died of the illness who was healthy, or they said they didn't have those risk factors? Any of that?
So if people who are healthy have gotten the virus and died from it that didn't have any other risk factors, I don't think we have enough data to know that yet. I know that the media and the public health authorities have tried to give us as much information as they can within the limits of protecting people's privacy and confidentiality, healthcare confidentiality. So far, most, if not all, that I've seen have had some sort of underlying illness. Now, I don't know about this. So today is March 4th. I think yesterday or day before, there were two 20-year-olds, boys, that were admitted to Swedish Issaquah right down the hill here with COVID-19, coronavirus. And I don't know anything about their underlying health. One would think that they probably were in good health, but these could be guys that just happen to have bad asthma, or there was somebody who posted something on our Facebook yesterday who said, I had cystic fibrosis and lung transplants. She's a young woman, so she'd be at very high risk for getting exposed and developing severe disease from this. So, but primarily it's the older folks. The mortality rates in China, as best we know and as best we trust the information coming out of China, have been upwards of 15 to 16% in elderly and 0 in kids under 9. And then the range between 9 years of age and elderly goes commensurately upwards as you get up there. So, 9%, 2%, but across the board it's probably 2 to 3%, which is much higher actually than influenza. But another part of the good news about this virus is that it doesn't seem to spread as readily as influenza does. Influenza spreads really fast, nowhere near as fast as, say, measles, which most people have forgotten about. But with measles, the R value, which is how many people get infected by an initial person that has that disease, is like 15, whereas influenza is maybe 1 or 2 or something like that, or 3. And this one seems to be hovering around 1 or 2. And the same thing with the mortality rate. Overall, 2%, maybe 3%, and that is higher than influenza. Influenza generally runs 0.1 or 0.2% globally. But in individual subpopulations, it can be higher depending on that population. Another thing about a pandemic virus is that nobody has ever been exposed to it before, so nobody in the world has any resistance to it. They don't have antibodies that fight it off. And that allows that virus to go from person to person to person more rapidly than one that already has a certain amount of immunity against it in that population. So this is why we talk about herd, H-E-R-D, immunity. If 60% of a population gets their vaccine against any disease, then it tends to protect everybody, because that illness, that virus generally, can't pass through the population rapidly because there's so many people that already have immunity to it. It just sort of stops dead in its tracks. It's not 100% though. There's still people that will get it even with herd immunity. So you have another question?
So is this virus something that's just evolved then? If nobody's ever had this before, it just came out of nowhere?
That's a great question. I feel like I planted you guys almost. It's a great question. The question is, did this virus just evolve from somewhere? And the answer to that is yes. Viruses do this. They're nasty little critters. They not only do they evolve, but they mutate. They have these genetic shifts even, which is when we often have a pandemic, because such a big shift has occurred that immune response in all of us, even if we've had immunization against that particular virus, because of its shift, the immunization doesn't work, and so it can spread through too. So I can't say it came out of the blue. It's related to the SARS and the MERS viruses that caused concern a few years back, which is why one of the reasons they call it SARS-CoV-2, because it's very similar to the severe acute respiratory syndrome virus that was around, how many years ago? 10 years plus, thereabouts. So, yeah, they come out of nowhere and they mutate. They have genetic shifts and other little changes that allow them to get through the population because nobody has immunity, or very few people do. Once in a while, we'll see a virus that pops up, and you would think that it would become sort of a pandemic virus, but for some reason, it's similar enough to another virus that people had at a certain period of time, and they don't get sick and they don't transmit the virus easily, even if they come in contact with it. That's happened a couple times in our history in the last 50 to 75 years. So, another question.
If this is related or close to the SARS, and there was vaccination for the SARS, would they be able to get one for COVID-19 sooner?
Well, I can promise you they're working on it. I can promise you that all the researchers out there, and this is why I like science so much, because as soon as something like this happens, as soon as there's even an inkling, there are people out there writing up their grant proposals to the government or to WHO or to whomever, and asking for funding to do such and such research. You know, we want to study this particular part of this problem and see if we can attack it somehow. So that's an excellent question. I know darn well that there are people who are looking into that right now. I can name 5 biotech companies that are trying to produce a vaccine right now. And there are 2 big companies that produced HIV/AIDS medications, and they're going to do trial runs on those to see if those work against this virus. So prevention, vaccines, treatment, antivirals, including anti-AIDS, anti-HIV medications that are available. And they've already given several people just out of what they call compassionate care. They didn't have to, they're not doing a study, they didn't get FDA approval. They just thought, we'll try these drugs on these people. They're antivirals that have never been really studied well. They've had safety evaluations, they know they're safe to give. And I don't know what the results were, and they don't know what the results were yet because they just recently gave them to a couple people with COVID-19 in the hopes that it would save their lives. So that's why we call it compassionate care. Somebody who's near death, and they go, what the heck, we should try this medication and see if it works, because why not? So I know they've done that. Any other questions? I have some things that...
The demographics of the disease. There are a lot of parents with school-age kids in the community
Right.
who are freaking out about the fact that the school isn't closed. I shouldn't say a lot, some. I mean, if you were going to talk to people with school-age children, what would you tell them about how susceptible their children are to this disease?
So it doesn't seem to be as transmissible or as severe. The question is, how transmissible is it in children, and should we worry about kids going to school and getting it, passing it around? As I said, in China, they've had virtually no deaths in the pediatric range from 9 years below, 0 to 9 years, which is really remarkable because often in influenza pandemics or just even regular epidemics that we have in this country every year, just sort of endemic really, just sort of there every year, there's always a bunch of kids that die. And they're very young, they're very old, and people who have weakened immune systems or other underlying diseases are people who usually die from influenza that happens every year in this country and everywhere else in the world. It's just expected. And that's whether or not the vaccine has been matched close enough to the virus. So there's a number of people who just get it. I'm going to mention something about the flu vaccine too, because people say, oh, I took the flu vaccine and I got sick because of it, or I got sick in spite of it. The flu vaccine cannot make you sick with influenza. It can give you some side effects that feel like flu for a day or two. In fact, I just had my second Shingrix, the herpes zoster shingles vaccine. I was sick the next day after the second one. Aches, body aches, muscle pain, joint pain, fever, had a fever, headache, nausea, and then the next day it was gone, just like that. So it was a reaction to that second dose. And don't let that stop you from getting your Shingrix, because you do not want to have shingles, herpes zoster. But the flu vaccine, they have to match it about 6 months to 9 months before the flu season. Now, what did I tell you about the influenza virus? What does it do? Often and rapidly, it mutates, it changes. So if after the time they start producing the vaccine, and they use the old chicken egg method still to produce vaccine, 1 chicken egg for 1 dose of vaccine. So think of all the chicken eggs that have to go into producing all the millions of doses of vaccine. And if the virus mutates during that period of time when they're producing that 6 to 9 month long process, then they don't get a good match. Now with genetic recombinant technology, using yeast to produce the vaccine, they can shorten it to about 6 weeks to 2 months. And they're not, all the companies aren't geared up to do that yet, so we don't have a lot. We do have genetic recombinant vaccine available, but not the number of doses that we have, so we're still doing the chicken egg thing. So it takes a long time. So that's why sometimes we don't have a good match. But still not a good reason not to get your influenza shot, your flu shot every year. Because even if you get sick, you're much less likely to get bad sick and or die from influenza. So get your flu shot every year. Even if it's not a good match, it still protects you to a certain degree. So it's a good idea. And it wanes, that vaccine wanes after you've had a shot 3 to 6 months later. There might be some lingering immunity the next flu season. If it happens to be the same viruses that are going around that year, you'll still have a little bit of that. And as I said earlier, older folks need to get that high dose vaccine. And they just came out with the quadrivalent, meaning it covers 4 different influenza viruses, high dose. Before they only had 3 of the influenza viruses. I think it's 2As and 1B for the, I know it's 2As and 1B for the 3, and now for the quadrivalent 4, I think it's 2As and 2Bs, or it might be 3As and 1B. Those are the types of influenza that it protects you from. So if you're over 55, 60, somewhere in there, you ought to ask for the high dose. They probably give it to you regularly, automatically anyway, but ask for it. Question, yeah.
So to the previous question about should the schools close down, should the schools close down, should I stay home from work? What are those kinds of responses? What are the realities of those?
So the question is, should the schools close? Are kids going to get this disease and pass it on? So again, I'm going to refer to my bell-shaped curve. So measured value in this case is level of concern, fear, anxiety, worry, risk aversion, how averse you are to taking risks with yourself or your kids. There's some people who aren't worried about it at all, and there are other people who think that everything should close down completely until we're through with this pandemic. I don't have an answer because, first of all, it's going to be driven by whatever policy comes out of this area or wherever is going to be driven by people who are putting out the petitions, taking it to the school board, insisting on this, and the school board is going to have to respond or react to that to some extent. They're going to try to use science, but when you have a situation like this, science isn't always the thing that drives policy because they realize that it's important to keep the population not in fear, out of, not stressed, not unhappy, not just to get votes, but also just because it's a good idea to keep the population happy. So.
Well, you said you don't have an answer, but do you have an opinion? If they were to ask you, what should we do? How would you advise them?
So it reminds me of something that actually is in the bottom of my emails that I can't quote it exactly, but it's, if we have the data, let's use data. If we're operating on opinions, let's use mine. Okay. So my opinion is, based on what I know, what the data that we're seeing, and we're getting more and more every day, based on what I've seen, the risk is pretty low for kids to get it, and if they get it, they don't get sick or bad sick, and as I say, we haven't seen any mortality in children, which is a terrible thing to think about, and it's not very reassuring to say, well, the mortality rate so far is 0 in kids, so you don't have to worry. Well, I don't even want my kid to get the infection, much less die from it, so can you promise me that they're not going to get the infection and get bad sick? I can't promise that, and I don't think anybody can. I think what's important, and this kind of leads into my props here, and I don't know if Nani, you can hold them up. So I don't touch anything, by the way. When I came into Blakely Hall this morning, I opened the door like this with my elbow, and then I held it open with my other elbow and came in, and I'll do the same thing when I go out. I'll back out because it's a push-open door. If I go to use this, and it's sitting on a counter somewhere where everybody else has used it, what do I worry about? Everybody else has touched that right there. So I'll do this with one arm and catch I can't really demonstrate it, but, and then I'll get about that much, maybe a quarter's worth, and then rub it all over my hands, front, back matters.
But you get germs on your elbows and your arm.
Well, I'm not.
You go home, you sit down.
Oh yeah, no,
sit down,
so that, okay, you're up here somewhere, aren't you?
No,
So-
actually not.
And if I cough like that, that's allergy season. If I cough, you contaminated that right there if you're sick. Yeah, and you have to think about that. And if you want to, I came over here the other day and the coffee machine was out, and the wonderful little temptations that you guys put out that I couldn't resist. And every step I made, I thought, what am I touching? I'm touching this coffee button that starts it. I took they fortunately put some alcohol out, thank you, and I rubbed that down. I rubbed the cup down, the whole cup, and the handle. I just thought, I'm gonna do everything that you really need to do if there's a serious virus out there that we're afraid of. Things like fabrics don't really harbor very well, I mean, unless it's soaked. I saw a gentleman come in yesterday while I was here, an older gentleman, and his wife walked in, and I don't think I'm giving this, giving anybody's private information away, but he came in, and it was cold, and they were sort of bundled up, and he reached into his pocket, and he pulled out this handkerchief that looked literally like it was soaked from his previous blowing his nose into it, and I thought, there is a petri dish right there. And you should never use a handkerchief and carry it around in your pocket and be reusing it, and then who knows where it goes after that. So even though it may be a little bit wasteful, it's best to use a tissue that are always planted around. Everywhere you go now, there's tissues, which leads me to another thing. Masks. Masks don't do any good, and what they do is give you a false sense of security. You put that mask on, you think, okay, I can't get the virus now. And then you're walking around and you reach up under the mask because your nose itches a little bit or something, you reach up there for whatever reason, and you've inoculated yourself with whatever you have on your hands. So it's not recommended. I understand why people want to do it. It gives them a sense of security. But as long as they keep their hands out of their face, it's fine if they want to wear the mask. But if they wear the mask and think, oh, I'm protected, and then do something stupid like that or rub their eyes, they're not protected against what's on their hands. So this is how you get this virus. I mean, if somebody coughs right in your face or sneezes right in your face, yeah, you could get it from that for sure. It's mostly droplets. It's not aerosol, fine aerosol particles like measles gets carried that way. And even tuberculosis, which is almost unheard of these days, can be carried that way. But it's mostly droplets. Somebody sneezes or coughs into their hand, they touch the doorknob, they touch the flush handle, they touch the sink faucet handle, all those things. And they've done studies with motels where they've gone into motels and tested all the things that people touch. The TV remote, one of the worst, and they're making them now with an antiviral plastic, which is interesting. It's supposed to kill anything that gets on. I don't trust that. So you really need to decon your room when you go in there. And what I use, and I used to tell the folks out at the Hanford site, because they worried more about infectious disease than they worried about chemicals or radiation exposure or heavy metals or anything, is I say, get something in a container like this, read the label, and if it's got 2 or 3 things on it that you can't pronounce, it's probably good. So it's usually some sort of benzalkonium chloride or tertiary or quaternary ammonium compound, ammonium chloride. And if it happens to also have alcohol mixed with it, that's even better. So, which leads me to the alcohol, so to speak. It has to be 62% or greater alcohol content for it to be effective. They studied this. The reason this is drinking alcohol, which it is, it's ethanol, all these products are ethanol, ethyl alcohol, is that the rubbing alcohol that you probably have in your bathroom cabinet, which 70% to 90%, works just as well, even better. But the problem with isopropyl alcohol, because of the configuration of the isopropyl part, it gets into the fat in your skin and just dries you out like crazy. People wouldn't use it. They did test runs, and they wouldn't use it, whereas they used the ethanol because it didn't bother their skin as much. It'll still dry out, but nothing like isopropyl. But if you run out of this stuff, and you've got rubbing alcohol at home, it works perfectly well. And you can use it to decon surfaces too. But I think this is probably better. It comes in a little, you just pull out the,
If you can find it.
Well, yeah,
Requirement.
I don't know if Costco has it, but it has individual sheets. You just pull them out and just swab everything down. And when you're deconning your hands or surfaces or anything, it's really important that you have this wet time. In other words, don't get it wet and then wipe it down and dry it off. It needs to just sort of evaporate. So the wetter, the better. Remember that. Same with your hands. Sometimes I'm gonna dry my hands out here. Sometimes I'll put some in my hands and I'll go like this. I'll do my nails, under my nails, because this is where things really get hard. And then I'll hold my fist closed like this so it doesn't evaporate. And I'll hold them like that for 30 seconds to a minute. It's not that long. I'm not doing anything else with my hands at the time. And that gives you much better contact time with the viruses and bacteria and fungi, whatever are on your hands. And be sure to get all parts, because we have a tendency to go like this with our hands and our noses. And you saw Pence on viral video the other day. I don't know if you saw it, but they were up there giving a discussion, trying to give a discussion about this coronavirus. And just as he finished, he reached up and pinched his nose like that, and then right after shook somebody's hand.
Oh, gosh.
And this went viral because they just said, here's the guy that's supposed to be talking about pandemic preparedness and how not to get it. So they've done so many studies with how many times people touch their faces. When I used to teach at Bellevue College, and I'd point this out because I was talking about everything in my environmental science class, including pandemics, and I'd always catch 3 or 4 people who were sitting there like this with their hands in their face, and I said, you just contaminated your face. Wherever your hands have been for the last day or two, if you haven't been washing them assiduously or using alcohol, you're contaminating yourself. And that's why kids and other college students and everybody get these viruses, because they don't think about that stuff. They will now because of coronavirus. I think this is good. It'll probably reduce the number of influenza cases we see and colds and everything else, because hopefully they're using these things. Other questions? Yeah.
So if somebody touches this door handle out here,
Right.
and then nobody else touches it for a while, how long does the virus, would it stay on a door handle?
So hold the other question. Let me answer that one. So how long will that virus linger on fomites, which is what we medical people call inanimate objects that can harbor viruses, bacteria, fungi, and so forth? I saw the other day that one study has been done on this particular coronavirus, COVID-19, SARS-CoV-2, that's the virus, 2 weeks.
2 weeks.
That's what, now, it all depends on temperature, humidity, how much was left behind. If somebody coughed in their hand, it was wet, and they left it behind, it's going to last longer. But certainly, it's something to think about, because if somebody touches a handle or touches anything else, and then you come along and touch it now or an hour from now or next day, and nobody has sanitized it, you are at risk. You now have a nice culture on your hand that if you touch your face, this is how we get viruses: mouth, nose, eyes. Rub your eye, pick your nose, pick that spinach out of your teeth, whatever. Bingo, you've inoculated yourself. So yeah, it can linger. And some viruses linger longer than others. One of the big concerns out at the Hanford site when I worked there the last 15 years was MRSA, methicillin-resistant Staphylococcus aureus. And the studies have been done on that too, and it can stay for hours or maybe a day or 2 as well. So somebody that has MRSA, they rub a sore, they walk out, touch a handle, or go to the bathroom, use the whatever facility, they can inoculate, they can contaminate that too, and somebody else comes along, gets it, scratches a mosquito bite, and they've got MRSA.
Along that same line, you see where they close schools, and they're spraying or disinfecting the whole school, and they're opening the next day. I mean, isn't everybody that was there on Monday, that disinfected on Tuesday, they're all back on Wednesday, and whoever.
And I think unfortunately what often happens is we don't plan to do studies, but we all are guinea pigs all the time.
Yeah.
And some of us pay the price for that. And that means that if they let the kids go back to school, and then all of a sudden 5 to 7 days later or 2 weeks later, a bunch of them get sick, then you have to say, ooh, what, how did that happen? It must have been transmitted in school before we did the decon. And now we realize that we have to start thinking about closing the schools down. But in a sense, it's just an ongoing study. Keep the schools open, hope the kids don't get sick. If they don't get sick, we were lucky. But if they do start getting sick, we've got our study answer right there, and that's when we shut it down. So sometimes you wait until things happen, and that's just human life. I mean, you can't get around it. We can't just respond or react to everything 100% and say, okay, we're going to do this. But on the other hand, The reason that I think, and the experts are saying this too, that this COVID-19 hasn't blossomed more than it has. Just you notice today we're not getting a lot of news about, we're getting a little bit, but not like a huge bump. It can still happen, but I think the reason is because of the incredible quarantining and isolating of people who have been exposed, whole cities getting shut down in China, public health measures that have taken place in the states where it's occurred in this country. I think that's a good part of the reason why we're not seeing a huge increase in the number of cases. So one more thing about protection. I'm kind of an environmental nut. I haven't worn shoes in my house in 50 years because that's where a lot of stuff that's on the, think of the stuff that's on the sidewalks and everywhere you go. And if you walk down in Seattle, you got all kinds. I lived in Seattle for 4 years, and I would never have worn my shoes in the house. But I started doing that when I lived in Virginia 50 years ago. When I go to the gas station, the gas pump, I use vinyl gloves. A lot of people are allergic to latex, and so I recommend either vinyl or nitrile. When I pump the gas, not so much because of what might be on the gas handle, but think of that. How many people have touched that gas handle, that pump handle? But I don't want to get the gasoline on my hands because it really wrecks your hands, and I'm really sensitive to it, and I'll get a rash on my hands. So I just pop one of these on. I have them in my car. And then when you take them off, you just pull it inside out like that, discard it. So, but these are good to use if you're going to decon with something like this. You want to put a glove on just so you don't get that stuff on your hands because it's irritating and drying. And anything else that you do, if you're taking care of a member of the family who's sick, a good idea to just pop one of these gloves on each hand and when you're taking care of them. And if they have a respiratory illness, put a mask on them because if you're close personal with somebody who's coughing and sneezing, then it is a good idea to wear a mask just like they do in the hospitals. Any other questions? I had
The summary comment?
well, I had a few things that I wanted to mention, and you can edit it out, any part of this, but let me just look and see what so I mentioned the definition of pandemic. My daughter called me yesterday, and she said, Dad, she's in her senior year at the University of Washington. She said, Dad, I got a question. I said, what? She said, there's a formal this weekend. Should I go? She said, where's the line drawn between paranoia and living your life? And I said, you know what? And I told her about the bell-shaped curve, which she knows about because she's sort of studied science. She's doing medical anthropology as her major, crazy major. And I said, you just have to draw your line, but you need to base it on all the information you can get, all the information. And you also have to base it on your decision about how meticulous you're going to be about protecting yourself. Now, you're not going to wear a mask, and I wouldn't recommend wearing a mask, but you are going to keep a distance from people. Are you doing any cheek-to-cheek dancing? And she just laughed at that because I don't think people do that anymore. I said, remember when you walk in the door, are you going to grab the handle? Do you have alcohol in your pocket or in your purse? Yes, yes. Are you going to stay away from anybody that looks or acts sick? Yes. What about if you go to the table, and one of the things that I really think is funny is buffets, where you go and everybody has handled the handle. They don't want you to touch the crackers or the cookies, the food. I don't touch those handles because that's where the germs get spread. I reach in and very carefully grab the piece that I want with my fingers, and I don't care what anybody around me thinks. If they criticize me, I'm going to say, that handle is where we pass our germs, back and forth. So I'm just going to grab my cookie or cracker or whatever. Obviously, some things you have to use.
Buffets are ruined for me.
You have to use a handle, but some things, I'll take a napkin and hold it with that, or I will go ahead and just use the handle, and then I'll swab my hands down with alcohol. And another thing about restaurants, just think about who has set your table and who's handled your utensils and your glasses and so forth. I mean, if you really want to get carried away, there's so many ways that viruses get transmitted in our population that you could just be constantly worrying about it and dealing with it. So if it's not that serious and there aren't that many people around getting sick, then don't get too paranoid and carried away with those protective measures. But still,
one of the things it's
excuse me.
These people that are getting it are showing virtually no real bad symptoms, and they just go out living their life, and yet they're out probably spreading it around. And people that are compromised, come in contact, and there's really not much you can do.
There's not much you can do, you're right.
Do you have any idea how it got into the nursing home?
I don't, but there's a wonderful study that was done very quickly with this group in Seattle and they did the sequencing of the genome of this virus. In fact, they've already shared it worldwide, and I've seen responses about this, and went, wow, you really did a good job. And they've found some very close matches between the fella in Everett that got it and the viruses that killed these people in the nursing home. So somehow, I was talking to my wife about this the other night, I said, you know, somebody up there in Everett that he came in contact with got in contact with somebody else, who got in contact with somebody else who had a relative at the nursing home, who went to the nursing home. Maybe they were a little bit sick, transmitted the virus to one person in the nursing home, or it could have been a staff member, and bingo, that's how these things work. Here's another thing. I mentioned to you guys before, because you have your puppy with you, your dog with you, that camels, cattle, cats, and bats. I love that. Camels, it's kind of fun to say, camels, cattle, cats, and bats carry this virus. And there was one report of a dog that had been found positive for this virus in a family who had a family member who had the virus, and so they just decided to test the dog, and sure enough it was positive. And the only other thing I wanted to say was there have been at least two studies done on what is a fever recently in the last 2 years. We've always thought that 98.6 was our normal temp, but it turns out that information came from things that were done 100, 150 years ago, when everybody was walking around with tuberculosis and gingivitis and all kinds of things. Now they're saying that a normal temperature is about 97.8 for most of us. The best thing to do is take your temperature when you're feeling great, take it once in the morning, once in the evening when you're feeling good, and write it down and say, this is my normal temperature. It's always going to be different between morning and afternoon. Okay, usually lower in the morning, higher in the afternoon. Then you know what your normal temperature is. Then if you're feeling crummy, and you take your temperature, and it's, you know, your normal is 97.9, let's say, and you've got 98.6, you've got a fever. So it's a good idea to do that. And this is, you're going to see more about this when it gets into the lay press, but I've just seen it in the medical press so far that
So any
we're gonna have to
increase
change
like
our-
that, slight increase, is considered a fever?
well, yes, but I mean, if you're half degree up, it could be you're just metabolizing or you've been running around. But if you're a degree above that, Fahrenheit,
Yes.
degree and a half, 2 degrees, yeah, you got a fever. And you know, if you get up to what would be the equivalent now, we consider a fever as anything over 99.5 or something like that. Now we're thinking that's really a fever, not just a kind of a fever, but that's a fever, because if the normal is 97.8, then 99.5 is up there. And so 104, which some kids will pop like that, that's even more of a fever, because you know. So we're adjusting. All the thermometers that are out there in the world are going to have to change. Can you imagine? Any more questions? Yeah, I think I covered everything that I wanted to cover. And thanks for your questions. I'm really delighted that you're here, because they were good questions. One more
What's the
question.
difference between a pandemic and an epidemic?
Well, the difference between an epidemic and a pandemic is the question. The epidemic is a increase in anything, not just a disease, but it could be accidental deaths or, you know, train wrecks or something like that. You say we have an epidemic, it just means that it's above the normal range, anywhere, in any population. A pandemic, as I say, pan is all people worldwide. Remember Pan American Airlines? So worldwide, pan across all the continents. And so it has met that definition. It's not as rapidly transmitted, this virus is not as rapidly transmitted as some. So they're kind of holding back and really calling it a full-blown pandemic. But we do know that it can be lethal, so it still meets 2.5 of the 3 criteria. So I've seen a number of authorities calling it a pandemic already, but as I said, it's a trigger word. People don't want to use it. So, but we are in the midst of a low-grade pandemic. Thanks.